I'm setting my timer. I'm just going to cut this part. Okay. Hey, I'm Mary. I am a nurse practitioner student in Auburn, and these are my subjects for the video. Y'all can introduce yourselves.
Hi, I'm Jake.
Hi, I'm Philip.
Okay, and they kindly let me come to their office today to do this portion of the interview. So the purpose of this video is to discuss the roles of the nurse practitioner. So I'm going to ask them some questions and just kind of gauge their knowledge and then educate on points where needed. So the first question is, what does FNP stand for and what can an FNP do?
It's a family nurse practitioner.
Correct.
And what can they do? Jake, you want to elaborate?
Family nurse practitioner can do a lot of stuff.
I feel like they can do, what a doctor can do for the most part, I think,
Yeah.
I mean, I've had experience with them in my life where they've treated some of my grandparents and stuff. That was their primary, was a nurse practitioner at Brookwood. I think it was Dr. Snow was the name.
Was that the hospital or like a primary?
It was at the hospital.
Okay.
Yeah.
Okay, so y'all are correct. So the definition, when you look it up, is an advanced practice nurse, or APN. This is defined internationally as a nurse who has attained specialist knowledge, makes advanced clinical decision, and performs an expanded practice role in his or her specific context of practice. So they can independently assess, diagnose, order labs, write prescriptions, under a framework of collaboration with other medical providers. And the second question is, can an FNP diagnose illnesses?
Yes, absolutely.
Yes.
Okay, yes. So an FNP may assess, diagnose, and treat acute and chronic illnesses. And this kind of goes into the third question, can an FNP manage chronic and acute illnesses?
Absolutely. Like the example I gave you earlier.
Right.
Dr. Snow.
Dr. Snow.
That was the nurse practitioner?
Yes.
Okay.
I mean, they called her Dr. Snow,
Right.
but that's just because they were old.
Okay. So that's an important part of a nurse practitioner, is managing acute and chronic illnesses, like chronic stuff like diabetes, or acute things like upper respiratory infections. So that's a huge part of the role of a nurse practitioner. So question number 4 here, do you think a FNP has to collaborate with a physician?
No.
Not always, no.
What do you mean by not always?
I mean, they may want to collaborate with a physician if it's something, if it's something long-term, maybe they would want to collaborate with a physician. But no, I think they have the same reach as a regular physician.
I think it's also the severity. So
The severity, I think that's what I was looking for.
If it's like a common cold or the flu, then no. But it's like somebody coming in with like their arm cut off, and yeah, probably.
Okay. So this actually depends on the state. So some states have full practice authority where nurse practitioners can practice independent of a physician, but Alabama is restricted, or reduced. So this means that the NP has to have a collaborative agreement with the physician. And what this means kind of depends on the facility, but it pretty much means that there's a collaboration agreement that outlines specific details on what the physician and the nurse practitioner are collaborating with. And then some other states, I think like California, they're restricted practice states, and this means that the nurse practitioner has to work under supervising physician for all of their scope of practice. All right. Can a FNP order diagnostic tests?
Yes.
Yes.
And what are some examples of these diagnostic tests?
Like blood tests, like
Testing for your triglycerides,
Right.
stuff of that nature, things of that nature.
What
urine
about
tests,
X-rays?
X-rays.
Yes, absolutely.
CT
Yes.
scans?
Yes.
Yes.
Okay, correct.
CT scan for sure.
So that's a really important role for the nurse practitioner. It would be very difficult to, diagnose any illnesses if you weren't able to order any pertinent like lab results or diagnostic testing like X-rays and stuff. So that's definitely something that nurse practitioners do. Can an FNP do simple office procedures?
Yes.
Absolutely.
Okay. So you think if you go in, they can do some stitches on you?
Yeah, absolutely. I would ask one to do them for me at my home if I lived with a nurse practitioner.
All right. So yes, small office procedures like sutures, pap smears, and like splinting of any extremities is something that falls under the scope of FNPs. And then I printed off here, this is from the Alabama Board of Nursing, and this is prohibited procedures for the nurse practitioners and CNMs. So Botox is actually one that's listed on here, which I found interesting. Chest tubes, which is a very invasive procedure, so can't do chest tubes. Any complex suturing, insertion of a central line or subclavian vein, any nasal endoscopy, needle aspiration of a breast mass, percutaneous liver biopsy, and trigger point injections above T12, and any vacuum-assisted vaginal deliveries. So that's what is prohibited for nurse practitioners in Alabama.
So when you
currently.
say a vacuum assisted
Mhm.
delivery, so does that mean any delivery of a baby? So they can deliver any baby, just if it involves the vacuum, they cannot. Is that what you're saying? Okay,
Right.
just
They
wondering.
can't, do like a C-section.
Of course.
My baby was delivered vacuum
Really?
a month ago.
Well, a nurse practitioner didn't do the vacuum.
As a doctor.
Really? Now we know that.
And he talked about Taylor Swift.
And a lot of nurses, if they work in labor and delivery, will go back to midwifery school and become midwives. But they don't do C-sections.
Interesting.
All right, where are we at? Can an FNP write prescriptions?
Yes.
Absolutely.
What about narcotics?
I would say they can.
I would say they can within certain criteria.
That's correct. So,
It depends on the label, like the class narcotic.
yes, that's right. You know all this. So FNPs can write prescriptions. So narcotics can be written as long as they have a federal DEA number. In Alabama, physician oversight is required for NPs to prescribe medication. So this goes along with that collaborative agreement that the NP will have with the physician. And can an FNP bill for their services?
Absolutely.
Yes.
Okay. Again, this kind of depends on the state. So they have to have a provider number in order to do this, and then I printed this off as well. This is from the Roche website. So in order to bill independently, they can bill on services provided such as evaluations, diagnostic testing, and certain procedures without the physician present. But they are only compensated 85% for the services rendered in comparison to a physician. So that's kind of interesting. Okay. What is the difference between an NP and a PA?
NP is a nurse practitioner and PA is a physician's assistant.
That's correct. Do you know like differences in the roles?
Physician's assistant is more, I guess, like, how can I say this correctly? They are more higher level than an NP, I guess.
See, I would think the other way around.
Really?
Yes.
Okay. So the duties kind of overlap a lot with NPs and PAs. The main difference is PAs work under the supervision of a physician in every state, and this is kind of changing. So in most states, like North Dakota, Utah, and Wyoming, they can work without supervision, so it's kind of changing throughout the years. And NPs currently have full practice authority in 27 states. PA programs emphasize general medical practice, and NP programs have a specific population or field of practice, such as family practice or primary care. Another important thing is NPs kind of work under the nursing theory scope, whereas PAs work under the general medical scope. And after the education and discussion today, do you feel that FNPs should have full practice authority in every state? So this means they can work in an office without oversight from a physician.
Yes.
I agree.
Okay. What is something interesting that you learned from this?
Well, I didn't know they could deliver babies, but not with a vacuum.
Not with a vacuum. What about you?
I think I learned the difference between a PA and an NP.
Have y'all ever had any experiences with a nurse practitioner in an office or in the hospital?
Yeah. There's one where we go to, I think, or I don't know if you go there, Jake, but you know the clinic we have set up for work, the main person you see when we do our annual wellness check is a nurse practitioner. And seems like she really knows what she's talking about. So.
Okay. Do you feel like there's a big difference between when you see the doctor versus a nurse practitioner or a PA?
I feel like the only difference is going to be the difference you create in your mind. Like,
Okay.
you know, oh, the doctor's going to tell me this, I'm scared. But, you know, the nice nurse practitioner told me I should, you know, eat less and exercise more.
Okay.
But when a doctor tells you that, you may take that like, oh my gosh.
Okay.
Yeah.
So would you have any hesitation in seeing a nurse practitioner over an MD?
I would
Or
probably
do you-
prefer it.
I prefer it. Actually, my guy is an NP.
Your primary care?
Yeah, primary care.
Okay, interesting.
Yeah.
Well, thank you guys very much for allowing me to come here and ask you guys these questions.
Thank you for having us on camera.
Absolutely.
And that concludes our interview.